Hello, everyone. Welcome to my literature review presentation. My topic was on medulloblastoma, and I decided to go ahead and narrow that down to medulloblastoma occurring in adults. And as most of us know from ClinPath, medulloblastoma is a very common tumor in the pediatric population in actually really young children, actually being the second most common cerebellar tumor. But adults can also be affected, which I did not know before picking this topic. And why is it important that medulloblastoma occurs in adults is because it's actually a little bit different from what we see in children, which I also would not have known. So it tends to behave differently in where it arises within the cerebellum, little differences between the symptoms, and the biggest differences being between the molecular subtype and also the histological subtype as well. However, even though there are differences, I learned that because it's so rare to occur in adults, there's really not a lot of research that's been dedicated to it simply because they don't have enough patients to conduct clinical trials on. So they've extrapolated all the treatment protocols from research conducted on children, which is important because the way that we treat children may not necessarily be the best way to treat adults. So the goal of this literature review and this presentation is to highlight the differences between the two age populations. So looking at where it's similar between adults and children and where it's different, and understanding the importance as it relates to our practice. So the three articles I have chosen to discuss in this presentation, the first one is by Ebel et al. From 2021, and it's titled Medulloblastoma in Adults, Reviewing the Literature from the Surgeon's Point of View. So he gives a really good outline just about how it presents. Obviously, as a surgeon, he's going to have to know how to correlate the symptoms. And we see the main differences arising in the tumor location. So as you may recall from ClinPath, in children, medulloblastoma arises along the cerebellar vermis. So it's going to be right in the midline, where if you bisected it through the vermis, theoretically you should have tumor on both sides. But in adults, the vermis is actually not a common location. It tends to arise in one of the lateral hemispheres, so either the right or the left half of the cerebellum. And you may not necessarily see it if you cut it straight down the vermis. So because of this location, there are a few differences in symptoms. I'll be honest, most of the symptoms are very similar because they're related to the mass effect. So you're going to have things like headache, especially upon waking, nausea, vomiting, visual disturbances, increased intracranial pressure, and then hydrocephalus. But the main symptomatic difference is that in adults, based on the tumor location, it tends to produce ataxia of the appendicular skeleton. So they're going to have muscular problems in their limbs, whereas in children, they tend to have ataxia of the trunk. So they may be collapsed or have truncal instability. The second article that I'll be talking about briefly is by Woolley and Panis-Prado, also 2021. And their article was Pediatric versus Adult Medulloblastoma Towards a Definition That Goes Beyond Age. And this article is really great because they were able to compile a lot of data around the different molecular subtypes and the different age groups. So there are 4 molecular subtypes based on the genetic pathway that's involved. And then 2 of those are actually undefined, which you'll see. So the first one is called the wingless type, or WNT molecular subtype. The second one is sonic hedgehog, or SHH. And then you just have group 3 and group 4. So they're not really sure what's going on in the final 2, but hopefully with more research, they will be able to figure that out. And then there's also 4 different histological subtypes that this article talks about. which is classic, is the first one. And that one is, again, what we covered in ClinPath, so a small round blue cell tumor with characteristic Homer right rosettes. And then the other three are variations. So you have the desmoplastic, or also that's called the nodular subtype, anaplastic subtype, and then large cell subtype. So the World Health Organization, the way that they recommend making the final diagnosis of medulloblastoma is by combining the molecular subtype and the histological subtype. So going back to this article, from the data they provided, they found that around the ages, so from 0 to 18, so still encompassing the pediatric range, they pretty much find a very wide variation between molecular subtypes. There's not really one that's sticking out more than the other. It's just kind of equal across the board. But once you reach over the age of 18, it's almost 70% accounted for the SSH molecular subtype. So pretty stark difference between the two. And they also found that only 3% of adult medulloblastomas are in the group 3 category. So that really narrows down what an adult is most likely to have. In terms of the histological subtype, the children overwhelmingly present with the classic subtype, regardless of the molecular subtype, and adults, again, overwhelmingly represent the desmoplastic or nodular histologic subtype. Moving right along, my third article is by Luck et al. 2021 again, and it's SEOM, Clinical Guideline for Management of Adult Medulloblastoma. So this is where I think the most interesting part comes from. So he talks about the standard treatment methods for treating medulloblastoma in children and how that has been extrapolated to adults. So it basically starts out with surgical intervention. So they go in and remove as much of the tumor as they can without just disturbing or disrupting any other important structures in the cerebellum, followed by craniospinal radiation with adjuvant chemotherapy. And the chemotherapy is where it kind of gets a little bit different between the two. So I believe the standard regimen is a combination of at least 3 different chemotherapeutic drugs. And they find that in children, children, they're much more resilient than adults. They're still growing. And so they tend to tolerate the treatment a lot better. When you become an adult, you're much less resilient. So you start seeing a lot of different toxicities, hematologic toxicity, peripheral toxicity, and you start receiving or seeing patients that have permanent neurologic defects just by undergoing treatment. And so he kind of goes through, him and the other authors, they go through, different ways to potentially alter their regimen, usually by reducing the dosages of drugs, which they acknowledge pretty much has to be in all cases because patients just simply can't tolerate the procedure. All right, so how does this even relate to us? So I have some lovely pictures here of some medulloblastomas. These are pretty much the only 3 pictures that seem to exist. So I could not, unfortunately, find one of an actual adult patient. This middle one here, I'm not even sure if you can see my pointer, but the middle one on the slide was actually from a 16-year-old. So she's still pediatric, but kind of approaching definitely the older end of the spectrum. And she unfortunately passed away. So this was her from her autopsy, which is probably going to be the most relevant setting for us. But you can kind of see it does, it's hard to say where it arises from, but it most likely would have been along the cerebellar vermis. And you can tell that it's just very infiltrative. You can appreciate that in the first image as well. Again, this is, well, I didn't have a case history for this one, unfortunately, but based on the fact that we can see it through the bisection, this one is probably also a cerebellar vermis mass. And then the picture on the right, I wish I had like case reports for these, but I would think that this image of the tumor probably came from a surgical resection, I want to say. Um, Again, just pure speculation, but you can kind of appreciate that it's obviously well circumscribed, probably soft and just pink tan color. So they're kind of like nondescript gross appearance, honestly, in my opinion. But regardless, in the forensic setting, you're going to have to be able to look at the clinical history if it's provided, know recognize their symptoms and correlate that. So obviously in a child, a medulloblastoma is most likely, if they're presenting with the symptoms, that's going to be considered part of the differential diagnosis, but not so much in adults. So you should just keep it in the back of your mind that this is something that you could find in the adult population. Sampling tissue for molecular testing. So as I said, there's very little research into adult medulloblastoma, and based on the fact that two of the subtypes are still up in the air as far as they're not really sure what causes it, you may be submitting some of this tissue for research purposes, and you're most likely going to need it fresh. So just something to keep in mind. All right, so just to close it up, I have this nice table just kind of summarizing the differences between pediatric medulloblastoma and adults. We kind of already went through that, so if you would like, go ahead and review that. Again, adults do not tolerate the standard treatment well. I really think there's a lot of room for research into this, because it really is a disservice to the patient if they're, potentially going to have deficits just from the treatment. We obviously want to minimize any type of side effect, especially permanent side effect if we can. You can tell from the articles that I had were all published in 2021, so pretty recent. I couldn't really find anything more recent, but it does sound like they are headed in that direction of finally taking a look at adult medulloblastoma more seriously. That kind of goes into my next bullet point of investigation into the molecular subtype. So really honing in on, again, for the adults, that SSH molecular subtype, really looking into that could help formulate a better treatment plan. And then finally, as it relates to us, as I just discussed, we should be aware that these do occur in the adult population. So you should never rule out this kind of tumor, either in a forensic case or even potentially this could be a clinical autopsy case easily as well. Yeah, so that was my presentation. Thank you all for listening, and I will see you later.